5 minutes.
Thank you, Mr. Chairman. I first want to enter into the record a letter and report from the Chicago Foundation for Women, an organization that for the last 30 years has really focused on in lifting up women and girls. And in their report, among other things, they say, quote, how they discuss how, quote, caregiving responsibility has landed squarely on women throughout the pandemic. So if I could have unanimous.
Without objection.
Okay. I would like to devote the rest of my time to Ai-jen Poo. She is, as you know now, the executive director of the National Domestic Workers Alliance and caring across the generations, who has done so much, I think, to raise the important issues of what the needs are right now in our economy and for so many people. And if you would focus especially on workers, you know, we call them the heroes of the pandemic, and yet they are in such great need. If you could talk for a while. 5 minutes is so short that you had before. Take the rest of my time.
Thank you so much, Congresswoman. I do want to take a moment to just name that among the fastest growing job categories in our entire economy, not just for women, but in our entire economy, are personal care aides and home health care workers. And these are workers who earn on average $18,200 per year. Because of the growing aging population in this country, we know that the demand for this workforce is only going to continue to grow. Congressman earlier mentioned rural communities. There are massive home care deserts throughout rural communities all over this country because we have labor shortages. Workers cannot survive on the income that they earn and pay for gas to get to work on the incomes that they earn. They don't have access to health care or a safety net or paid time off. The quality of these jobs is so poor that we cannot sustain the current workforce we have, let alone the huge demand that we need going into the future as an aging nation. We have the opportunity to make these jobs good jobs for the 21st century, just like we did for manufacturing jobs in the 30s, where one generation could do better than the next. If we invest in care jobs becoming living wage jobs with real economic security and access to a safety net, we will create a pathway to the middle class for literally millions of working class and working poor women and their families. It's a win-win-win investment. And the cost of elder care to states right now is extraordinary because of our over-reliance on nursing homes and nursing home care. When we invest in a home care workforce and home and community-based services, which is a big part of the plan in the Build Back Better agenda, when we invest in home and community-based services, we are investing in cost savings on the part of states and the federal government long term, because the cost of home and community-based care is a third of what it costs states to pay for nursing home care for people who need it. So it is a win-win-win. Lower costs for states and the federal government, better jobs for a group of workers who've been forced to live in working poverty and their families, support for working family caregivers who need the support of a strong workforce and access to these programs in order to participate in the economy, and a dignified quality of life for our growing aging population in this country and people with disabilities who need these services and prefer to live and age in the home and community. What could be a better investment of our public dollars? And in investing in this workforce, these are job-enabling jobs. They are supporting all of us, working class families who need this care, to be able to do and contribute what we want to on our terms across all sectors of the economy. So I do want to say that the care economy investments are, in my mind, the highest return on investment, both from a job standpoint and from a long-term economic sustainability for working class families standpoint.
Thank you so much. Appreciate this, these additional words. Appreciate it.